So no swearing, no anything. Okay. Is it going? Okay. So first I'm just going to make a little nick into the skin. Especially in a really dehydrated animal, it just will open up the area a little bit so you don't get hung up on the skin with your dilator. To attempt to place. So first thing is just over the needle catheter. I'm going to try to introduce this into the vein. And sometimes it takes a couple tries. You can just strum the vein back and forth to kind of see if you can get your placement. And I'm going to advance this catheter. And then I'm going to, as I take the stylet out, I'm going to put my finger over it right away because also it'll bleed a lot. Set some gauze here. Next up is your guide wire. I'm going to back the guide wire into the casing, and plug this into the catheter and start advancing that. And the guide wire has nicks on it, so you can kind of see how far you're in. There's the triple nicks right there. I don't know if you can tell them very well. But. And I'm going to pull the catheter off, keeping the guide wire in place. The most important thing is to always maintain contact with the guide wire, whether you're distal or proximal to the catheter or dilator that you're placing at the time. So after the guide wire, the dilator goes on. And I'm just maintaining gentle pressure on the incision site too, so it doesn't bleed out too much. What this does is just enlarges the hole in the vein and the skin. I'll lift up on the skin and then just advance. As you can see, I'm also holding onto the guide wire with the back of my hand too. And this is usually the most uncomfortable part, is the guide wire. So after that area has been stretched out a little bit, and my catheter is going to go over my guide wire. And I'm going to keep feeding this until I see it loop out the back of the distal end port. And I usually try to hold on to that with my pinky so I can keep contact with my dilator. And then this is going to just follow the path of least resistance, which is just right along the guide wire. And then you can just feed this in to the vessel like that. And then once it's placed, I like to put my caps on right away as well. And I'm just going to test this. So I'm going to always aspirate back first just to see that I have blood, but also to get any of the air that's out as well. And sometimes the catheter, if it's a severely depleted patient, the catheter edge will get hung up on some of the vessels. So sometimes you have to flush a little bit first to kind of coax it in. So both of these are functioning for the moment. And these are just my caps to keep the ends of this clean. So the final step to this before bandaging is to suture it. And this has a groove and then 2 wings for the suture material. Oh. On top of the needle box there, needle holder. So the first one I do is the little groove. He just gets all of that, Mike. And I always suture these just slightly going off to the side because if I don't, sometimes this the way these will sit is just right up into the animal's face, so I always just do them just a little off to the side.
You didn't bring me a new one? What is the difference? Do you have an invoice? Do you have the receipt? No.
The total 30 maxes. Thank you.
I think that was it. I think that was it.
Where was it?
Yeah, okay. That was just what I had.
No, this is your change. He said it was a very old one, but he looked at the prices and he's never else did.
Oh.
I put some in my room. It's perfect.
It's hard to see because it's so bright what you're doing. I can't get a good. Okay. Because the light. Yeah. When we pull that away, I might be able to get a better view of it. And that concludes the sterile portion of our procedure. I can see much better. And then we just need to bandage it, and then we'll be set.